So it's the university, the visa, the foreign workforce, and then finally the health council. Then you should be ready to go. They don't really require you to write exams unless you did your undergrad where you were not using English or English wasn't your first language. Then you have to take the English exams. But otherwise, there's no board exams or anything like that that you have to take.
Hi, everyone. Welcome to Making Healthy Choices with Dr. L, where we discuss careers in healthcare, roles of different doctors, and what it is that they do on a daily basis. So today I bring you Dr. Ngwisanye David, who is a general surgeon who recently completed her general surgery residency. If you're somebody who, for example, has looked at South Africa as an option to do your postgraduate medical training, but you've always wondered, what is the application process? Like, what are the steps involved? What is the cost involved? So we're going to have Dr. Ngwisanye David taking us through the process and what it is that you need to do in order to get a residency training or postgraduate training spot in South Africa. So without further ado, Dr. Ngwisanye David, please take it away.
Hi, everyone. Applying for South African residency or registrar post, as we call it here. So I'll talk on more of a supernumerary post, which is a foreigner coming into South Africa. So one, you have to get an offer letter that says you have been offered this registrar post or residency post in which department. So for you to get that, you have to talk to the head of the department where you want to go into. So I wanted to go into surgery. So I had to talk to the head of surgery in vets. And then they did offer me a post. And then there's the postgrad office also, which the head of the department of surgery will tell them that they have accepted you. So the university can also accept you. So once you have gotten that, you deal with the process of getting into South Africa now. So you have to get a study permit or a study visa, which you have to apply via the South African visa offices in Botswana, Gaborone. They're based in Main Mall. But for them to give you a visa, there's the foreign workforce, which you have to submit to them, and then they have to clear you. The other condition with the foreign workforce is that you need to have a medical aid. So you cannot be allowed to come and study here without being covered by a certain medical aid. Just as you know, medical aid is quite expensive. So there is one particular one that is called Momentum that does offer student medical aid, which others don't really have such a thing. So you have to really pay a hectic amount. But for Momentum insurance, they do have small fees that actually suits students. So most of us have used that one. So that's the one that I'll advise one to use. Unless, of course, you have good sponsorship, you have good source of income, you have the income to pay for a better medical aid that covers quite a lot. The only disadvantage with it is that it finishes quite quickly. If you have serious medical issues, that one will not suit you. If you are just as healthy as you can be, then that one will suit you. The foreign workforce will then be in touch with the visa place where now the visa will be issued for you. And then you take your visa and your offer letter and go to the Health Professional Council, HPCSA. Then you get registered with all of this. So it's the university, the visa, the foreign workforce, and then finally the health council. Then you should be ready to go. They don't really require you to write exams unless you did your undergrad where you were not using English or English wasn't your first language. Then you have to take the English exams. But otherwise, there's no board exams or anything like that that you have to take.
That's an interesting thing, because in the US, the UK, and Canada too, you have to take exams before you can even think of applying for a residency position. So you go through a lot of costs before you can even apply. Just to backtrack a little bit before we get into the cost. So the first point of contact or the first step is to reach out to an HOD or head of department. Is it in a hospital or a head of department, say, for example, at WITS, at the university? Like, who are you reaching out to exactly? And do you reach out via email, via letter? Do you write a letter? Like, how do you reach out? Like, how does that process look like?
So basically, is the head of surgery or head of department at VET. So they are still part of the hospitals, but the entire general surgery department is overlooked by that person.
Okay.
So how I did it, I reached out via an email because I was in Botswana. Actually, they do respond to emails, and then once they've offered you a position and there's a position, you are in touch with their secretary and everything is processed via email. But in the case where they take long, you might have to drive here and come here in person and get things done in person. But mostly for me, it was more of email. Yeah.
Where did you get the information for that particular person, like on how to contact them?
So they do have, because they're lecturers at VETS, so they do have their information, all of it, in the VETS website. Yes, you can just type head of surgery at VETS, and then their emails and all their contact information will appear there. Then you can use that email, and they do respond to that. So when I sent my email, probably within 24 hours, I got a response, but it wasn't like, yes, you have a position. It was, we acknowledge your email, we look into it. So they asked for the CV, certificates, and then after a week, they said they actually do have an open position, so I can start the process of applying. The process of applying itself is the one that can drag, because there's a lot involved.
Where do you submit the application? What are the application requirements?
You send your inquiry email to the head of the department, and then they'll let you know what they want. For, like I mentioned, for me, they asked for CV and my qualifications. And then they did say their department has a position. And then they refer you to their post-graduation office. So the post-graduation office then writes that offer letter that the university is offering you this position at VETS to come and study as a supernumerary registrar. And then once you've gotten that from the post-grad office, then you take it to apply to all other offices. The visa office, the foreign workforce, and the HPCSA.
Once you got that offer letter from VETS, what was the next step?
So the next step was to get a study permit. So for the study permit, they have their own requirements. They have a list, actually. So you go to their office and show them your offer letter, and then they'll give you a whole list. From what I remember, that can drag the whole study permit process. If you didn't qualify in South Africa and you qualified somewhere else and you studied for 5 years, they need a police clearance. So you can imagine I'm in Botswana and they want a Jamaican police clearance. I had to get my fingerprints in Botswana, post them to Jamaica, get contact person to collect them at the post office and submit them to the police office. And the police office then took it from there and tried to clear you that you didn't commit any kind of crime in those 5 years. And then they post it back to you. So that took quite a long time. Once you get your police clearance, then there is this thing of health insurance that you need to have. So you need to apply for it and pay for it. They'll actually want you to pay upfront, like 12 months upfront, because you're a student and you don't have like proof of source of income. So they want to be assured that you pay for like 12 months in advance. You need to have proof of where you're going to stay. So you actually have to look for a landlord before you even start anything who can write you a lease so you can submit it for the whole process. So those were the main things that I could remember. Other things are just small things like passport photos and all of that. And then once you've submitted all of that, the foreign workforce also has a whole list, which the university will link you with the foreign workforce and the international office, student international office. They work together and you fill all their forms, you submit whatever they want, and then your study permit will be processed. Actually, you can do concurrently with the health professional council. They can start processing once you submit your offer letter and while you are also waiting for your visa.
Do they need proof that you've submitted an application for your permit, for your student permit, to start the HPCSA process? So you can just submit the offer letter from the university,
your qualifications, and then also, like I mentioned, if you qualified outside South Africa, they also need a verification. So for me, I had to get it from Jamaica also, which also was a bit of a process. But if you studied here in South Africa or, well, wherever you studied, they need a verification also.
Okay.
So those were the main things that they need.
And then once you have your study permit and HPCSA has processed and you're registered with them, what's next?
So then you are done. You are ready to start your residency.
Is there a particular date or time of year that they would want you to start?
Registration, I think, is usually at the beginning of the year with the university.
Okay.
And the second semester is usually in July. So you can also start in July. But with your department, they can still allow you to come and start. But with the universities, just when to pay your school fees. But you can and be in the department and then get to pay your school fees while you are in the department.
I guess every system has its requirements, and it's good to be familiar with what it is that you're required to submit. Submit it in a timely manner if you can, or as quickly as you can. So there's no need for exams. So there's no costs associated with exams in order to apply. However, there are costs. Like you mentioned, you had to send stuff all the way to Jamaica to get your fingerprints sort of verified and you cleared from a criminal point of view. And then you also had to get health insurance, which you had to pay 12 months upfront. You had to get a place to live and get a lease. So those are costs. So let's try and break down the costs. So reaching out to the program director, there was no cost to that. But just take us through the process and what each step costs.
Yeah, sending an email didn't cost anything. And then the post-grad office also responding to you and sending all the requirements didn't really require any payment. I think I only started paying when looking at the list that was needed. So for me to send my fingerprints across the seas, I can't remember the exact cost, but it was postal cost. I think by now have changed. It's been 5 years now. In terms of medical aid, at that time when I applied, it was 380 per month. So I had to pay 380 times 12. But they increase every year. And remember, every year you have to register with the university. So when you register with the university, they also want your medical aid to be up to date. There's a fee at the visa office. It changes every year. I think at that time it was 1,000. Okay. So now you have to check as the fees changes yearly. HPCSA also has its yearly subscription. So when you register for the first time, you pay. At that time, it was 1.5. And then also their costs keep on increasing. I think at the moment we are sitting at 3,000. So which you also have to pay every year. Overall application fees and all of that, probably 5,000 or 6,000.
So when you get your visa, is it a visa for the entire duration of your study, or do you have to renew it every year?
The visa covers the entire time, according to the offer letter. So the offer letter, if it says your program is 5 years, the visa is going to be 5 years. It only changes if you need extension, then you have to reapply now. If you have done your 5 years, but you still need to extend, do certain things, still need to write exams because of this and that, emergencies that came along, then you have to reapply again. I'm not sure about the process of reapplying because I haven't done it myself.
Compared to the US process, this is a really good option because I feel like you don't have to take exams. Yes, you have to take exams, I think, during the course of your training, right?
Yeah.
But before you even apply, you don't necessarily have to take exams. But I've heard of people talking about like a part 1 exam, there's a part 2 exam. But for somebody who's like me out there, who thought there was like a part 1 exam, there's a part 2 exam, what are people talking about as far as the South African system is concerned?
So those ones depend on the department you are going to. So for us, part 1, we also call it primaries. For surgery, we have 3 exams. Most departments have 2 exams. So they have part 1, which is primary, and then they have the finals. And then those ones, you do them during your training. Mm-hmm. So for us, it's primaries, which when you start as a junior resident, you must actually know, it's more of your anatomy, your physiology, and, your pathology. So that's what the exam is all about. And then the intermediates is now, it's about patients, critical care for patients, mostly trauma and ICU, and emergencies. How do you manage emergencies? In the midway of your training, you should be in a position to differentiate a P1, very sick patient, P2, P3, intermediate, and a patient who can go home. So those are what the exams are all about. And then the final exams now, you having basically a conversation with consultant to consultant kind of thing.
So you don't necessarily have to take these exams before you start your training.
For part 1, actually, they encourage that you take it before you start because it puts you a step ahead for you to get the position compared to someone who doesn't have. If you write it outside the program and someone comes in planning to write it in the program, they'll give the one who has primaries the position first versus the one who doesn't.
Is there a cost associated with those exams?
So the part 1s, you can write them wherever you are. When you are in Botswana and you are planning to take surgery, or you are planning to apply for surgery or whichever specialty you want to, you basically liaise with College of Medicines of South Africa. So then you write the exams for the college that you want to, like College of Surgeons or College of Internal Medicine or Dermatology. So you write those exams as part 1. The cost for the exams, it changes from year to year. So when I wrote, it was 2,000 rands that time when I started, but they increase every year and each exam has its cost. The primaries, the part 1s, they have lesser cost. And then the more you go up, intermediates, it was like 5,000. And then the finals now, it's like 17,000.
So do you just go on the college of whatever college of medicine, if it's College of Surgeons, do you go on the website to find out more about the exam?
Yes. So you go onto the CMSA website and then you apply. So they have certain dates also. They will actually put out the dates on their website and the closing dates. And then you apply and then you submit your proof of payment. And then you'll be registered. But that's only for part 1. For the rest, you have to be in the post and you need letters from the head of the department that you have done a rotation in trauma, a rotation in ICU, and you have knowledge in it and you can write the exams. Those ones you can write when you're outside, but primaries or part 1, you can write when you're outside. You don't need anybody's letter, actually. You can just go into the college website, you write the exams, and then you tell your department that I actually wrote.
So these exams, are they taken online? Is it a physical exam? Do you have to go to an exam center to take it? Like what are the circumstances surrounding the exam?
They are not online. So if you are in Botswana, the College of Medicines, actually, they do come to Botswana, to the Botswana University, and you go to a hall and write the exams for the primaries. That's just for the primaries. The rest, you have to be here. You have to be in South Africa and you have to be a resident.
Training, yeah, like in a training position.
Yes.
Okay, I like that system. It sounds like it's not as expensive as if you're looking at a US option. I think the US is the most expensive one, followed by the UK. Not sure about the costs in Canada, but I do know that there's exams that you have to take and you have to pay for them, but it's not as expensive as the US. Thank you very much for breaking down that process for us. I hope that this benefits somebody out there who's looking to do specialty training in South Africa. It is a good option, especially if you are within Africa or even if you're in other parts of the world. The training in South Africa is world class. So if you're looking into it, don't hesitate. If you have any questions about the process, drop some comments down below or questions down below, and I will try the best that I can to get information for you. Maybe Dr. Nkisanyi David can also chip in the comment section and try and respond to some of your questions if you have any. Any last words from you?
I mean, the process itself of applying can take you up to 3 months. And sometimes people tend to drag and not respond to emails and all of that. It's up to you to follow them up, be on it, and keep pressing for it. Yeah, it can literally take you up to 3 to 4 months to actually finish everything. So you just have to be a bit patient, press, and then you find yourself in the program.
Thank you very much for that advice. Thank you again for making the time to join me on this video and for sharing your invaluable knowledge. All right, guys, thanks for watching this video till this far. If you've watched till this far, kudos to you. If you found this useful, please share this with somebody else so that they can benefit as well. All right, guys, bye-bye.
Bye.